Now, I love me some piercings, but I'll tell you, after seeing some of these Helix ones go wrong, unfortunately, the cartilage up here has a really crappy blood supply, so it's more prone to getting infected, abscesses, deformities like cauliflower ear, oh, and necrosis, where they actually have to cut your ear off. And ear piercings are a huge culprit, but other things can be trauma to the ear, like a bite, a scratch, a burn, even having surgery on that area. And surprisingly, even having a really bad swimmer's ear infection of the canal spreading out to this area can be a cause. So you're likely going to know you have it because your ear is going to be really red, it's going to be really swollen, it's going to be hella tender. And the big clue for us as physicians when we examine your ear is that this earlobe is spared. Now, one of the most important take-home points for this infection is that you cannot treat it with regular antibiotics for cellulitis like Keflex or Augmentin or Bactrim or Clinda. The most common pathogen that causes this is Pseudomonas aeruginosa, and it has to be treated with a fluoroquinolone, even in kids. Now, typically in kids, we don't treat them with fluoroquinolones, but in this particular instance, the benefits outweigh the risk, and we will. Now, if you end up having a fever, you're having systemic symptoms, like you're having like body aches and chills, they're concerned for an abscess, you may actually be admitted to the hospital and get some IV antibiotics. They may even call in ENT to take a look and see what needs to be done. Now, to help you differentiate between the perichondritis and cellulitis, the cellulitis is going to involve the earlobe. And see how up here is spared, this cartilage looks okay, but the earlobe is angry. Typically, this is caused by staph or strep, and those are treated with the typical antibiotics that I mentioned before. So if I have a patient come in to see me with this red, hot, angry ear that is more painful than it looks like it should be, and it's shiny and it's deformed, you're going to the ER. This is not a simple skin infection, and a delay in care can cause a permanent deformity of the ear. I'm Dr. Key, and I hope that this video helped you. If you liked it, be sure to give it a like and follow me for more pediatrician tips. And if you've got a friend thinking about getting a Helix piercing, be sure to send this to them to freak them out.